Hi, my name is Susan Salvo, and today we're going to do an abdominal massage routine. This is Paige, my volunteer, and Chelsea is on the camera. I want to first review the structures of the large intestine over here. Here is a picture of the large intestine. It starts in the cecum, goes up to the ascending colon, takes a turn by the liver called the hepatic flexure or the right colic flexure. Transverse colon is next, and it takes another bend at the splenic flexure or the left colic flexure down to the descending colon. Then it makes an S curve called the sigmoid colon, and then the straight portion is the rectum and the anus. The important thing to remember is that the contents of the colon go in a clockwise direction, and that it starts here as far as its exit point. It begins here. Okay, so on a female client, you have to worry about this on a male client, but on a female client, you have to worry about covering the female breasts. So in this case, we're going to use a folded pillowcase. This is a standard size. You can use a king size pillowcase, or you can use a towel, but this is fine. Now, once you have it covered up, then you're going to hold the top of it and then pull down to where it creates kind of a bikini top. Nice and slow to make sure everything stays covered, which it has. And then you're going to take it and move it down to about the level of the iliac crest. And on her, they're about right here. And then I like to tuck it nice and tight here, and tuck it nice and tight here. So you're exposing her abdomen. I also want you to notice that her knees are on a bolster, which is going to help the abdomen relax more. And I'm using a 6-inch bolster, and I like to move the knees a little bit apart, and this is where I like to put my massage cream. So we've already done an intake, and we're going to start with some basic effleurages to apply the cream. So here, I'm using a stacked hand circular effleurage over her abdomen. And again, I'm encompassing all the area, ribs to iliac crest. I'm doing a kneading stroke, petrissage across her abdomen, just to make sure we have cream also on the sides as well. Okay, which we do. So again, I'm going to go back to the stacked hand circle effleurage, moving in a clockwise direction. And then what I'm going to do is I'm going to start at the sigmoid colon. I call this uncorking the colon. You're going to do a circle and a tail. Come up an inch, circle and a tail, circle and a tail. And if you notice, I'm just following the direction of the colon, but I'm going backwards to try to be sure that the contents closest to her rectum is cleared out before I start moving anything from the other areas of the colon down. So again, you do that 3 times. Uncork the colon, looks like a comma, circle tail, circle tail, circle tail, and remember moving backward to the colon. Circle tail, circle tail. Then what I'm going to do is I'm going to pray your hands, and I'm going to vibrate the 4 corners. This is the cecum. This is the hepatic flexure, the vibration. I'm going to the splenic flexure, and then the sigmoid colon here. Starting around her navel, I'm going to do a stacked hand, and I'm going to do a vibration in an expanding circle from the navel out to the borders of the abdomen, which again are the rib cage and the pelvis. You can also do the vibration like we just did on the flexures all over. The intention here is to increase the peristaltic activity of the colon or large intestine. You can do a diffused Topotomal. Notice I'm dragging my hand, and notice how I am doing a loose fist over my relaxed bottom hand. Then what I'm going to do is I'm going to start moving. Basically, I'm working on her back in a pulling motion. You can actually grab into the glutes, which is gluteus medius. Here, it should feel pretty good. And then you can actually do a little bit of raking the ribs. Hopefully you can see my fingers in between her ribs here, moving up. Usually at this point the client goes, oh, that feels so good, because you're lifting and almost stretching a little bit on the back here. Okay. You can, if you're comfortable doing this, take your fingers going onto the edge of the ribs and taking her ribs and kind of going a little bit into the diaphragm. There are some trigger points that are sometimes into the diaphragm. Noticing I'm folding the rib cage onto my bottom hand. Got some girdling going on there. And kind of burying it into the area of the diaphragm, not too deeply. This is kind of a sliding, I'm going this way, I'm not going down. I'm going, my pressure is upward, not down toward her vertebra. Okay, good. Then you're going to do the other side, which I'm going to walk around. Try to stay in contact with the body if you can. Not a requirement, just something that feels good. And then we'll do this side. Pulling, pulling, pulling. And you can get pretty far down, but it's upper glutes. And then pretty much underneath her rib cage. Pretty much under her arm too. That's how far back I'm going. Very nice, good. Boy, I got a tight QL going on over here too. Okay, so from here, I'm going to just lift and just pull and come up. Now when I'm pulling up almost straight to the ceiling like this. I'm not going down like this. It's straight up to the ceiling like this. And that helps release some pressure off the back. Good. Now, a little bit more cream. I know the skin likes this. Then what I'm going to do is I'm going to put my hands with my fingers pointing up toward her head, separating. My fingers are touching each other right now on her lumbar vertebra. Then I pull up, come back to its starting point. Then I'm turning, and as I'm turning, my hands are turning too, pointing down toward her feet. Separate, touch the back, pull, and then onto this position, turning again. And you can just do this for maybe 3 or 4 times. And pull up. Very nice. And again, circle effleurage, stacked hand. This is called a sun-moon. Learned this in an infant massage training. It's wonderful in adults. The bottom hand, my my left hand is moving in a complete circle, and my right hand is working in a semicircle. So my left hand is like the sun, and my right hand is like the moon. Nice. Alternate hand, circular effleurage, stacked hand, one-handed effleurage, and then two-handed effleurage. Then what I like to do, I like to just hold the tummy and just do a nice little vibration. And then slow it down, and then release your hands. And I certainly hope that you enjoyed this abdominal massage routine. Thank you, Chelsea. Thank you, Paige. Have a great day.